Hi, it's Anna Jyoti from the School of Fine Tuning, and I'm just showing you some pregnancy massage skills. So we're going to begin with setting the bed, how I would normally for a massage, except I've slightly elevated my bed, or you would put a couple of pillows here just to raise up really ever so slightly in a side position. And I'm just going to put a pillow, just lift your legs, right in between and support all of the knees and the leg, so a full support so that we're comfy. And then enough towel to cover over the whole body and the baby bump. This goes over the top, and then I would put a blanket again over the top just to make sure that body is fully covered. Perfect. So for the leg uncovering, I'm going to show you, it's more about the towel technique, and then I'm going to show you a few different massage techniques. The massage techniques, to be fair, are pretty much the same as how you would usually massage. So we're looking at effleurages, petrassages. The main vibe really of this treatment is about relaxation and also lymphatic flow and blood flow. So we're going to take the towel up. It's really important to make sure that this area here is very much kept modest, and the top is also kept modest. So you can't hike right up to the top here unless you were to have lots of towels and drapings. I'm going to bring it pretty much up to here, and that's very safe and secure and feels modest. So now for a couple of techniques. I'm using coconut oil. Can come up a little higher just to get right up the leg, especially if your client has any sort of sciatic compression, but just to be mindful, because if I did take the towel up any higher, this whole area would be exposed, and we don't want that. Okay, so lots of drainage. I'm just going to show you a few techniques. Nice drainage from the ankle where fluid retention and puffiness, edema can gather. Lots of effleurages here. And then, as with your normal massage, I mean, you can still work, if you've trained with me doing your hands-free massage, you can work hands-free as we've learned before together. And then you can also work doing some knuckling techniques. Okay, I'm going to move through again quite quickly for the sake of the videos. Here you can do some knuckling techniques. Just be very mindful around the ankle area, medial and lateral, because there are acupoints and reflex points that are contraindicated. So the real contraindications are actually on the medial side. So you can just work in the feet as you would usually do, spreading thumb rotations onto the metatarsals. You can do the toes as you usually do. Okay, one technique that's also really nice, which you can do over the towel, is very slight, light, rhythmical pounding is nice. Okay. So you would do plenty of that. I'm going to just move through a little bit quicker, just while we make the video. Okay. So let's move on to the back area. And again, this towel positioning, if you come maybe here, I'm going to bring, because we can't pull the towel right down, because then you would expose the baby bump and the breast area. So we have to just work in this triangular shape, and then we can take an extra towel to tuck here. And to begin with, we're going to work pretty much this side, this left side of the body, a little bit here, but pretty much this left side. And then what we'll do is we'll turn my guest client over and we'll do it all on the other side. So let's get a little bit of oil just so I can show you a few techniques. The time frame is pretty much the same within an hour's session, in that you would do half an hour each side. So come over the top. What's nice is having the neck area in this position, working side position. So loads of effleurage to start with. Actually, I'm going to try and just expose here because, again, with our hands-free technique, you can work. You can start working nice and deeply with this anterior surface of the arm. And then I'm going to start moving up, and we'll do some circles around rhomboid and trapezius. Building up. So I've got my ulnar edge here coming up the neck, which is rather nice, and actually my elbow coming through the rhomboid space as well. You can work also from in front of your client. This was nice as well. And certainly use your expertise and intuitive flow and creativity. I would also, you can go up into the scalp here as well. You can go up and do a whole scalp massage from here as well. Nice to work the ears a little bit. Up into the neck. So this gallbladder 21 is contraindicated in pregnancy, but you can do sweeps over the trapezius. Okay, I'm just going to do a little bit down the arms just so I can show you. To include the arms, you might need to come all the way round. And here, just as we would usually do, you can do whatever technique. It's quite nice. I wouldn't pull too much because the ligaments are very soft during pregnancy. So I would keep it close to the body with some nice juicy squeezes. Working. Okay, so here you can do more extensive thumb rotations. And then all through the hands as you would be doing usually. This large intestine 4 is also contraindicated during pregnancy. And then you can do your individual finger rubs, whatever you want. So I'm just going to move on again for video purposes. Back round. This is nice, working like the erector spinae, intervertebral spaces. If I stand in this position, I've got a nice straight arm, straight thumb joint. The cameraman nearly fell over. Okay, so thumb joint, and I'm working through the intervertebral spaces here. Come and have a close up here, Gina. Here. So I'm working slowly. Okay, all the way up. And it's okay if you feel congestion and tension, then you can work as we would into it. It's okay. As long as you're not doing acupressure, I wouldn't go with deep acupressure in pregnancy massage. You can certainly go with more deep tissue and heel of the hand, but not getting your elbows in doing big acupressure techniques. I just wouldn't do that. It's very much about relaxation here and sweeps. Okay. So it really is about the freedom to work intuitively. You can do knuckling around the sacroiliac joint. If your client's got sacroiliac joint, you can work through that. All of that feels really delicious. Okay. And then this would untuck. Just one thing while I'm here, I just wanted to just reconfirm about the lymphatic nodes here, that if your client, just come here again please. If your client's got puffy ankles, you can work towards the popliteal nodes here, the lymphatic nodes behind. So really just gentle, it doesn't have to be really full on. And also around the kneecaps, a lot of strain and stress during pregnancy around the kneecaps, so you can work around the kneecaps. Another little tip that you can get ice cubes, or I do work with a lot of cold stones, but if you haven't got cold stones, you can make green tea ice cubes and then wrap them in a serviette or a hanky. But cold, these on ice is very nice. You can work to reduce puffiness with some cold jade wands is very nice. Or like I said, you can make some green tea ice cubes. They work nice on the face as well. And also if there's puffiness in the hands, you can use a bit of the cold stones in the hands. So I hope that that's given you a few ideas for pregnancy massage. I do a full qualification here at the school if you're interested in doing the full training. But just to give you a few ideas of the positioning, the towel techniques, and I use very intuitive methods here, although we know our skills and we know our intuitive way around the body, not to be afraid, to handle a pregnant lady, and you can work deeply without putting, obviously we can't put too much pressure onto the body because then we would rock the body over. At this point, I would then take the pillow out, turn my client over, re-put the pillow in, and do the whole of the other side. So thank you very much for your time watching. Quite a long video for me, but really a pleasure to share these skills with you. It's Anna Jyoti from the School of Fine Tuning, and the link is below. Thank you.